Diagnostic Testing Nursing Fundamentals Practice Questions. Question 1. A client is scheduled for a fasting blood glucose test. Which instruction is appropriate? Option A. Do not eat or drink except water for the ordered fasting period. Option B. Eat a full breakfast before the test. Option C. Drink sweet juice to improve results. Option D. Take extra snacks overnight. The correct answer is option A. Do not eat or drink except water for the ordered fasting period. Fasting gives the test a clean baseline. Food can blur the result like writing over a fresh page before reading it. Question 2. A nurse collects a urine specimen for culture. Which action is best? Option A. Use clean catch technique as instructed. Option B. Collect urine from the toilet bowl. Option C. Touch the inside of the container. Option D. Delay sending the specimen all day. The correct answer is option A. Use clean catch technique as instructed. A culture needs a sample that represents the bladder, not the environment. Clean technique reduces outside contamination. Question 3. A client asks why 2 identifiers are needed before blood draw. What is the best response? Option A. They help ensure the right test is done for the right person. Option B. They make the procedure faster. Option C. They replace labeling the tube. Option D. They are used only for children. The correct answer is option A. They help ensure the right test is done for the right person. Specimen identity is patient safety in a label. A tube with the wrong name can lead treatment down the wrong road. Question 4. A nurse receives a critical potassium result. What should the nurse do? Option A. Report the result promptly according to policy. Option B. Wait until the next routine note. Option C. Assume the lab made an error. Option D. Tell the client to ignore it. The correct answer is option A. Report the result promptly according to policy. Critical values are alarms from the laboratory. Prompt reporting allows the team to act before a number becomes a crisis. Question 5. A client is anxious before an MRI. Which question is most important? Option A. Do you have any implanted metal or devices? Option B. What is your favorite music? Option C. Did you sleep well last week? Option D. Do you like hospital food? The correct answer is option A. Do you have any implanted metal or devices? MRI magnets are powerful and unforgiving. Metal screening protects the patient from hidden objects that can turn dangerous. Question 6. A nurse prepares a client for a stool occult blood test. Which instruction is important? Option A. Follow dietary and medication restrictions as ordered. Option B. Mix urine with the stool sample. Option C. Use toilet water to moisten the sample. Option D. Collect after laxatives without instruction. The correct answer is option A. Follow dietary and medication restrictions as ordered. Some foods and medicines can mislead the test. Preparation keeps the result honest, like cleaning the lens before taking a picture. Question 7. A client asks why a chest X-ray was ordered after shortness of breath. What is the nurse's best explanation? Option A. It helps evaluate lungs and possible causes of breathing trouble. Option B. It measures blood sugar. Option C. It replaces oxygen therapy. Option D. It diagnoses every heart problem. The correct answer is option A. It helps evaluate lungs and possible causes of breathing trouble. Imaging can reveal patterns hidden beneath the ribs. It helps the team see whether lungs are filled, collapsed, infected, or clear. Question 8. A nurse is drawing blood from a client with N4 running in one arm. What is best? Option A. Use the other arm if appropriate and follow policy. Option B. Draw above the 4 site while fluid runs. Option C. Collect from the 4 bag. Option D. Stop all fluids permanently. The correct answer is option A. Use the other arm if appropriate and follow policy. For fluid can dilute or distort lab results. Choosing another site protects the specimen from becoming a mixed drink. Question 9. A client must provide a sputum sample. Which instruction is best? Option A. Cough deeply from the lungs into the container. Option B. Spit saliva only. Option C. Collect after brushing with mouthwash only. Option D. Touch inside the container lid. The correct answer is option A. Cough deeply from the lungs into the container. Sputum comes from the lungs, not the mouth. A deep cough gives the lab the material it needs to find respiratory clues. Question 10. A nurse prepares a client for a CT scan with contrast. Which assessment is most important? Option A. Ask about contrast allergy and kidney history. Option B. Ask about favorite color. Option C. Check shoe size. Option D. Assess handwriting. The correct answer is option A. Ask about contrast allergy and kidney history. Contrast can challenge the kidneys and trigger reactions. Screening before the scan prevents a helpful test from becoming harm. Question 11. A client asks why vital signs are checked before a diagnostic test. What is the best answer? Option A. They provide a safety baseline before the procedure. Option B. They replace the test result. Option C. They are done only for billing. Option D. They predict exact diagnosis. The correct answer is option A. They provide a safety baseline before the procedure. Baseline vital signs are the body's starting line. If changes occur, the nurse can compare rather than guess. Question 12. A nurse labels a blood specimen after leaving the room. What is the concern? Option A. Misidentification risk increases. Option B. The blood becomes sterile. Option C. The result becomes faster. Option D. The tube no longer needs identifiers. The correct answer is option A. Misidentification risk increases. Labels belong at the bedside. Leaving first creates space for memory and mix UPS, where errors often grow. Question 13. A client is scheduled for a lumbar puncture. Which post-procedure instruction may be expected? Option A. Report severe headache or neurologic changes. Option B. Run immediately after the test. Option C. Avoid all fluids forever. Option D. Ignore back discomfort always. The correct answer is option A. Report severe headache or neurologic changes. After spinal fluid procedures, symptoms matter. Severe headache or neurologic change can signal complications needing attention. Question 14. A nurse collects a wound culture. What should be done before applying new antiseptic? Option A. Obtain the specimen from the wound as ordered. Option B. Clean with strong disinfectant first. Option C. Apply ointment before swabbing. Option D. Swab intact skin only. The correct answer is option A. Obtain the specimen from the wound as ordered. Cultures should capture the organisms present before antiseptic changes the scene. Timing helps the lab identify the true culprit. Question 15. A client has a positive pregnancy test before imaging. Why must the team know? Option A. Some tests or radiation may affect fetal safety. Option B. Pregnancy improves every scan. Option C. It cancels all healthcare. Option D. It changes the client's identity. The correct answer is option A. Some tests or radiation may affect fetal safety. Pregnancy status guides risk and protection. The team can choose safer methods or shielding when developing life may be affected.